Hello, everybody, and welcome to this evening's presentation where we're going to be discussing the perimenopause transition and navigating this time, as well as we're going to be discussing the essential lab testing that I run for patients in my practice who are going through the perimenopause transition. If you are joining on TikTok, this presentation, if you want to see the slides, come join us over on the webinar. You can still sign up for that. It's linked in my profile. I'm going to have the TikTok live going, but you're not going to be able to see my slides. So if you are on the presentation this evening over on Zoom, can you let me know in the comment section that you can see me, you can see the slides. If you wouldn't mind to post there in the chat, that would be really helpful because I want to make sure that everybody can see it and that I can see your questions as they go through. So I do see some individuals on the webinar. I can see your comments, so that is all great. Thank you so much for joining. For those of you who don't know me, my name is Dr. Brianne Callanan. I'm a naturopathic and functional medicine doctor, and I help individuals get to the root cause of their health concerns. And what it means to practice functional medicine is really looking at optimal ranges when it comes to blood work. So we have these really broad normal ranges where individuals can still be symptomatic despite being in the normal range. And I work with individuals who want to feel optimal. And I don't believe that low energy, chronic health concerns, issues with your hormones has to be a result of aging, and there's lots that we can do to navigate it. So I do have a lot of slides to go through this evening. We're going to jump right in. If you could post in the comment section any of the questions that you have, post here, and then we can go through them at the end. I will be answering questions at the end as well. So one of the things that I wanted to start off this presentation with is the idea that many individuals will only realize that their symptoms were related to perimenopause 5 to 10 years later. And this is quite significant because I think we hear about the common symptoms when it comes to perimenopause, such as hot flashes, but really all of the other symptoms that come with perimenopause and this hormone transition that women go through are often less known and less talked about. So we're going to go through that as well. We're going to talk about all of the symptoms of the perimenopause transition. Why does cholesterol and blood sugar change with changes to hormones? We're going to talk about how estrogen impacts inflammation. We're going to touch on thyroid health. We're also going to dive into some of the lab testing and the markers that I run for patients in my practice, how to get tested, and the difference between blood testing for hormones as well as urine testing for hormones. We're going to touch on bioidentical hormone replacement therapy. We're going to talk about the Women's Health Initiative study and how that really did a disservice to women's health in general and the access to hormone replacement therapy. And we're going to talk about how you can access your own blood work. So how can you order it? Where do you go? What that process looks like. And of course, if you have any questions as we go through, make sure to post them in the chat, and then I can have a look at them as we go and answer them either as we go or at the end. What is perimenopause? So perimenopause is the transitional period prior to menopause, and this can occur 10 years prior to the age of menopause. So perimenopause can occur in the late 30s. It can go into the 40s. So it's not unreasonable to think if you're in your late 30s, early 40s, mid 40s, that your symptoms absolutely could be due to this perimenopause transition. We know that during this time that estrogen and progesterone levels do begin to fluctuate and they will eventually decline. And it's this huge fluctuation in hormones that we see in perimenopause that can create the symptoms and be particularly problematic for individuals. I explain perimenopause, the transition, more so as the second puberty. It is not this nice gradual decline in your hormones and then your period nicely stops. It is not, your cycles get lighter and they get spaced apart. That's often not what we see for women. We can see spotting, we can see more regular cycles, we can see more heavier menstrual cycles, and this can be particularly troublesome. Perimenopause can last anywhere from 4 to 10 years. And again, I really want to emphasize that age is not the determining factor in whether or not we should support a patient who is experiencing these hormones changes. Anybody who has symptoms related to their hormones, changes to their menstrual cycles, changes to their mood, changes to their sleep, absolutely we need to get testing done and investigate. We do know that 1 in 100 women will actually go through premature ovarian failure, which is the onset of menopause prior to the age of 40. And 1 in 100 is actually not that rare. So it does deserve to be tested, and your age does not define whether or not you should get access to testing. I think that's really important. Now, menopause is defined as no menstrual period for 12 consecutive months. We're also going to talk about different lab tests that we can get an indication of whether or not you're in perimenopause. We're going to talk about FSH levels, estrogen and progesterone levels, when to test, and what those values look like. At the end of the presentation, within 24 to 48 hours, you're also going to get an email. And within that email is going to be access to how you can get your own blood work testing, as well as I'm going to be sending over a cheat sheet with all of the lab markers that I suggest to run during this time, and what the optimal ranges are and what each of them means, and some tips in terms of how to address them. The low hormone state in menopause, this is really important. It's associated with increased health risk of cardiovascular disease, osteoporosis, and other chronic health concerns. So the perimenopause transition and the symptoms that we're experiencing are not just symptomatic. They absolutely can increase your risk of chronic health conditions and deserve to be looked into. I think this is an amazing picture and representation of what perimenopause actually looks like. It is not this nice gradual decline in your hormones. You can see the estrogen levels are very erratic. And it's the changes and the ups and downs in the hormones that many women are particularly sensitive to and lead to the concerning symptoms. Perimenopause, again, this is really important. It's like a second puberty. So we can see all of the same signs in terms of mood swings, irritability, difficulties with sleep, skin changes, acne, facial hair loss on the head. Many of these symptoms absolutely could be due to the fluctuations in your hormone levels. The most common symptoms when I surveyed my audience and my patients, weight gain is a big one. We'll keep in mind that my private practice is focused on resistant weight loss, so that wasn't a surprise to me. Many of my perimenopause patients also experience hot flashes. Sleep disruption is a big one, and this could be difficulty falling asleep, having lighter sleeps in general, waking up between 2 and 4 a.m. I see patients having irregular menstrual cycles, seeing spotting. Sometimes your period is 60 days and sometimes it's 20 days. This irregularity can be particularly bothersome and annoying for a lot of patients. Breast tenderness, fibroids, heavy bleeding is associated with perimenopause as well. And one of the things we're going to talk about is the importance of screening perimenopause patients for iron deficiency anemia. Iron deficiency anemia is more common in perimenopause due to the heavier menstrual cycles. That can cause brain fog, difficulty concentrating, fatigue, hair loss. Frozen shoulder is another one. I'm always interested when I do my exercise classes and I see women who are within that age range of perimenopause, and they're all talking about how their shoulders are sore, their joints are sore. And definitely having changes to joint pain and bone pain and frozen shoulder, we absolutely see related to the declines in estrogen. Itchy ears is another one. This one I hear a lot from my patients, and it's particularly, I'm going to say annoying again, annoying and bothersome to experience that itchy ears. Tinnitus or ringing in your ears can be a symptom of perimenopause, and this is one that a lot of my patients experience as well. The reproductive system, we talked about the irregular cycles. You can see fewer bleeding days. You can see longer bleeding days. You can see mid-cycle spotting associated with perimenopause, worsening of PMS symptoms. And this is, again, because remember back to that picture or that graph, the hormone fluctuations are quite big during this time, which absolutely can cause irritability, the sensation of feeling overwhelmed. You could also experience cramping without bleeding. In terms of the urinary system, in perimenopause and menopause-based patients, we can see increased urinary tract infections. We can see vaginal dryness. We can see increased incidence of BV or bacterial vaginosis. We can see candida and incontinence. When you're at the gym and you're doing jumping jacks and you're like, whoa, I need to go to the bathroom, or this is not an exercise I want to perform. Absolutely, declines in hormones can be related to that. In terms of libido, we can see a loss in sex drive. We can see painful intercourse. We can see a reduction in sensitivity. We can see difficulties achieving orgasm. And I think this is something that's not talked about enough. Having a lower amount of sex drive or a lack of desire for greater than 6 months, there is definitely treatment options that are available for women in terms of testosterone replacement therapy in some indications or some instances. It is definitely something to consider and speak to your primary care about. In terms of breast health, we can see tenderness, fullness, pain, benign lumps in the breast. Of course, we can see hot flashes related to perimenopause. This is the one that we commonly hear about, but there's also things like mood swings, irritability, aggressiveness, feeling overwhelmed or overstimulated, the sensation that sounds are just driving you nuts, or the sound of your partner chewing, or the TV and the kids talking and being on YouTube. It's just too much noise all at once. It could also present, previously you would have no problem going to the grocery store, or going to the mall, or going out to social events. And then all of a sudden, those social events become very overwhelming because there's just too much stimulation that you're getting during that time. One of the symptoms that I speak a lot about with my patients in terms of the declines in hormones is memory issues, difficulty concentrating. I see many women having to go part-time in their careers or early retirement just because the brain fog and the difficulty concentrating is so significant. If these are symptoms that you've personally dealt with, put yes in the comments, or if you're comfortable sharing the symptoms that you've experienced, because I think the more we talk about these symptoms, the more education and information that we get out there, I'm seeing lots of yeses, the better it is for everybody, because I'm not sure why, but we're not often discussing or talking about these very common symptoms that women will go through. And so many times individuals will go to their doctor and say, hey, could this be due to my hormones? I want to get my hormones checked. I think I'm in perimenopause. I don't understand what's going on. And a lot of times these individuals are dismissed. They're not getting proper blood testing done. They have no idea that these symptoms are related to their hormones. And oftentimes the only thing that's recommended is either birth control or a medication for anxiety and depression. And I'm not saying that SSRI medications are not helpful for moderate to severe anxiety or depression, but I think sometimes if we don't look for the underlying cause and we just give a Band-Aid like that, we're not doing patients a service in terms of really helping them to understand what is going on. Physical changes. We talked about the weight gain that we can see with perimenopause, especially the weight gain around the midsection. We can see changes to cellulite and an increase in cellulite that you otherwise didn't have. Difficulty falling asleep and staying asleep is a really big one that's often related to the declines in progesterone, and bioidentical progesterone can be quite helpful for individuals who are experiencing sleep disruption. Most commonly, I'll see individuals waking up between 2 to 4 a.m. They're just light sleeping. They're having a hard time getting back to sleep. I have a lot of comments saying yes to the symptoms. Itchy ears are the worst. Itchy ears, itchy ears. I have to share a little bit of a personal story here with myself. This last year, year and a half has been particularly stressful. I decided it would be fun to build a home in Latin America, in a place that I had never been. I don't speak the language, and it was extremely stressful to have to go through that. Stressful to the point where I had lost a significant amount of weight, and my menstrual cycle actually did stop due to that. And when I tested my hormones were that of postmenopausal. They were very low. My estrogen was low. And I can completely relate to some of these symptoms. Things are much better now, thankfully, but the itchy ears for me was a huge one. The brain fog and the difficulty concentrating, the amount of sticky notes and reminders that I had to have. And, even I'm sure Alison at my office, if you've ever interacted with Alison, she's amazing, but I'm sure she was like, oh, I need to set a reminder. I need to set a reminder. I reduced my work hours, and it was really disheartening because I just appreciate how significant having low hormones is from a quality of life perspective. And that's why I was so excited to put on this presentation today, because there are so many treatment options, and there are safe options available there for many, many individuals that can really help mitigate these symptoms. Joint pain, muscle pain, frozen shoulder. We talked about that. The declines in estrogen can increase inflammation. The declines in estrogen can be related to a loss of collagen, and that impacts your joints, bones. We can see dry skin, itchy skin. Some individuals describe it as like a crawling sensation over their skin. Zapping, tingling in the hands and feet can be related to lower amounts of hormones. You can see acne, more oily skin during this time as well. Someone commented here, I can't remember my students' names. Yeah, and otherwise, I'm sure that that was something that was a change for you if you've noticed with your hormones. Hair loss, we can see thinning of the hair overall. Obviously, if you've ever been pregnant or went through pregnancies, you get this thick head of hair because you have lots and lots of hormones. And then we can see the shed postpartum. Same way we can see overall hair thinning during this perimenopause transition as well. When we look at bone density, we know that the decline in hormones is also increasing individuals' risk for osteoporosis and bone pain, which is really important to prevent long-term. Neurological symptoms, you can see electric shocks, brain zaps, tingling in the hands and feet, that sensation of something crawling on your skin. Oral health, this is really interesting. So we can see increased incidence of gum disease, receding gums, sensitive teeth, burning mouth syndrome. That is a really challenging one and definitely can impact individuals' quality of life. We can see increased dental cavities associated with this time as well. You can actually see increase in allergy symptoms and histamine. Digestively, you can see increased bloating, heartburn, gas, constipation, diarrhea. In terms of body odor, we see changes to sweat production. So you might see that you smell a little bit different during this transition time as well. Changes to taste and smell is another big one that patients will describe to me. Things that they otherwise enjoy, they no longer enjoy. Smells they're particularly sensitive to, like I cannot stand this smell, I cannot stand this noise. And restless leg syndrome can be associated with low hormones as well. Next slide. So hormones impact every body system, and we can measure hormone levels with labs. So why test your hormones in perimenopause? It is true. Remember, we talked about perimenopause is this transitional time where the hormones are all over the place. They're high, they're low. Sometimes you're ovulating, sometimes you're not. It absolutely is challenging to test hormones during perimenopause, but as long as you know when an individual went for that blood testing in relation to their menstrual cycle, you can interpret it appropriately. Because the hormones are so variable, that is not a reason not to test. And labs are also important to rule out other concerns, such as cortisol concerns, your stress hormone, thyroid concerns that can mimic these symptoms that are similar to perimenopause. Running blood work is also important for the management of HRT and establishing whether or not you're on an appropriate dose, and as well to see if there's other underlying causes that could be making your symptoms worse. In my opinion, the two best ways to test hormones are either with blood work and the Dutch test. And the Dutch test is a dried urine test to have a look at your hormones. Now, blood testing is accurate. It's easy to do. It has a fast turnaround time. And blood work, you can also test your hormones, but also your thyroid. You can test FSH. You can test your blood sugar parameters. You can test inflammation. I think blood work, if we're going to look at one way to test, is the most comprehensive, and it makes the most sense in terms of how quickly we can get the results back in. Now, the Dutch test, which we'll share the slides of what the Dutch test tests for and what it's useful for, this is a urine test. And where the urine test can come in handy or helpful is it shows how your body is breaking down the hormones. And we actually know that when hormones are broken down, those metabolites or breakdown products can have different physiological responses in the body. Some breakdown products of estrogen, for instance, are beneficial to our health, whereas other breakdown products of estrogen are detrimental to our health. I also like the Dutch test or the urine test because you can do that at home 4 times throughout the day. Now, this is beneficial when looking at cortisol. Cortisol is our stress hormone. It should be high in the morning and low before bed. If you go in to do your blood work for cortisol, you are only understanding what cortisol is doing in the morning. You're not understanding what cortisol is doing in the afternoon, unless, of course, you go for another blood test or before bed. So the Dutch testing could be helpful there. I would suggest if you have to choose one, start with the blood work because it's the most comprehensive. The Dutch test is a nice add-on to look deeper at the cortisol response, and it's a nice add-on to look at how the hormones are interacting together, how the liver's breaking down those hormones. But if you need to start with one, I would recommend just with the blood testing. Menopause impacts the following: your cholesterol, your blood sugar, inflammation levels, your liver and kidney function, your adrenal glands, your stress glands, your thyroid, as well as, of course, menopause is going to impact your sex hormones. The first marker that's really important to look at on blood work is something called FSH, or follicle stimulating hormone. What we know is that as estrogen levels begin to decline, FSH is going to go up. And when FSH rises, we can say, hey, you're probably close to perimenopause, if not menopause. And when FSH reaches that threshold of being higher, it depends on what country you're tuning in from, Canada or US, but there's a certain threshold. Once it crosses that threshold, we can pretty much say, yeah, you've gone through menopause at this point in time. Although we do not call it officially menopause until you've had 12 months with no consecutive cycles. Estrogen plays a role in maintaining your metabolism and your metabolic rate. When estrogen declines, we can see a loss in muscle mass. And the less muscle mass you have, the calories that you're burning at rest will be lower. As estrogen declines, we can also see more fat being deposited around the midsection, and we call this visceral fat. And visceral fat is associated with chronic health concerns, and it's more related to inflammation. So one of the things, because my practice is focused on metabolic health and resistant weight loss, one of the things that a lot of my patients report is seeing not only an increase in their weight, but a shift in their body composition. So where they're holding weight changes. Usually we start to see more of that weight gain around the midsection, which we can mitigate. Now, because in perimenopause, the decline in estrogen impacts your muscle mass, one of my biggest recommendations for all of my patients in perimenopause is to do resistance training to preserve your lean muscle mass. It's never too late to start. If you're in menopause, it's not too late to start. If you're 60, 70, it's not too late to start. I would highly recommend that you consider some form of resistance training. If you follow me on any social media platform and you want some videos on resistance training, I have so many that I like on YouTube that are completely free that I'm happy to send over. Just send me a message. It is even more important during perimenopause to prioritize getting enough protein. You want to have at least a gram of protein per pound of your ideal body weight. So if a healthy BMI for you, or your ideal body weight, is 130 pounds, you want to aim for about 130 pounds or 130 grams of protein. At the bare minimum, I want every single one of you for the next couple days to get at least 100 grams of protein. And I would highly encourage you to get a very inexpensive food scale, measure the amount of protein, the weight of it, because so often, and I see this in the metabolic reset program as well, so often individuals think, yeah, I'm getting 30 grams of protein per meal. Yeah, I'm getting enough protein. But when they actually weigh their cooked protein, it is far less than they thought. And the only way to accurately know how much protein you're consuming is really to weigh your protein. It's not supposed to be, super stressful for you to do this. It's not supposed to be rather inconvenient, but if you can do it over a couple days just to really understand, are you meeting your minimum protein requirements? That's going to be important. And I also recommend, because so many individuals are not hitting their protein targets, add in a protein powder or an amino acid powder. I use both. I find the amino acids really do help in terms of food cravings. They can help to stimulate GLP-1, and this really helps with satiety. And amino acids are the building blocks of protein. If I don't hit my protein requirements, I would say every single day, 90% of the time, I'm having a protein shake. And it's not because I don't think food is best. I absolutely think food is best, but when you're busy, it's not always easy to reach those protein targets. My favorite protein powder is the Pure Paleo Protein by Designs for Health. It's gluten-free, dairy-free. You blend it up. It's 80 to 90% collagen-based as well, so it's great for hair, skin, and nails. Inflammation. How does this impact us? One of the markers that I run on blood work is called HSCRP. This doesn't tell us where the inflammation is coming from, doesn't tell us the cause of inflammation. It just tells us that inflammation is there, and then we need to do a thorough investigation to figure out why. I find in my patients who have high levels of inflammation, they really struggle with weight loss. I also find that inflammation is associated with increased risk of autoimmune conditions, whether it's lupus or celiac or Hashimoto's, an autoimmune thyroid condition. Inflammation disrupts hormone production, and we can see increased incidence of hot flashes with inflammation. Perimenopause and cholesterol. This one is particularly fascinating to me. When we look at adults age 16 to 44, so the age range when women would typically still have a menstrual cycle, men are more likely to have higher amounts of cardiovascular disease and high cholesterol. So men, 53% have raised cholesterol levels compared to women only at 46%. But during menopause, when the estrogen levels decline, it actually reverses. So it used to be when women had good levels of estrogen in their hormones, they had a slight protection from having elevation levels of cholesterol. I've got a fly in here that's driving me nuts. But after women go through menopause, it reverses, whereas women are 77% more likely to have raised cholesterol versus men at 67%. So HRT, hormone replacement therapy, is not indicated to be used in patients with high cholesterol. Like, we can't use it to treat high cholesterol, but it's interesting to know that estrogen does have protective benefits for your heart. And during perimenopause, when those estrogen levels fluctuate, after they've done the fluctuation, they fall in menopause. And this often results in the elevations in the cholesterol. So it's something to consider. In order to lower cholesterol, many individuals jump to food and they say, I need to take out eggs, I need to take out saturated fats, I need to take out red meats. But what we know is that only 20% of the cholesterol in your bloodstream is actually coming from the foods that you eat. So we need to look beyond diet to manage cholesterol levels. And there was a big push, of course, for this low-fat craze, lower your cholesterol, have low fat, have low fat, have low fat. And we have not seen reductions in cardiovascular disease from that. If anything, it's made matters worse because as soon as you switch to low fat, you take the fat out and companies are often adding extra sugars. And it's those extra sugars and the insulin resistance that is actually contributing to the concerns that we're seeing in the triglycerides and LDL levels. Taking bioidentical hormones, from what I've observed, I see favorable changes in cholesterol panels. Usually individuals who are on HRT, I see a rise in the beneficial cholesterol, the HDL, but it is important to note, if your only symptom is high cholesterol, we would not use hormone replacement therapy for that. By correcting the hormone deficiencies and replacing the missing hormones with hormone replacement therapy, it may help to lower your risk of heart disease in the future. We also know that insulin resistance is strongly associated with elevations in cholesterol levels, and insulin resistance is something that I'm passionate about speaking with, and we're going to see what insulin resistance is in the upcoming slides. If you are struggling with your cholesterol, a couple things that you want to do. You want to increase the amount of fiber in your diet. Get at least 35 grams of fiber, especially the fibers from plants. Increase your vegetable intake, focus on resistant starch from, I think plantains, yucca are all really great sources of resistant starch. You could consider a fish oil supplement if you're having concerns with your cholesterol panel. We know that the supplement berberine can have some favorable response in terms of insulin resistance and cholesterol levels. Turmeric, adding curcumin to your meals could also be helpful. These are the supplements here on the screens that are part of the Metabolic Max bundle that I've put together that are helpful both for cholesterol management and insulin resistance. This works really well for individuals who are struggling with resistant weight loss, but I don't want to focus too much on that in this presentation. Blood sugar. Insulin resistance is the condition that precedes prediabetes and type 2 diabetes. Many individuals will have insulin resistance for 5 to 10 years prior to being diagnosed with prediabetes. And this is where functional medicine and preventative medicine can really shine in helping these individuals prevent type 2 diabetes in the future. In terms of blood tests, you want to know what your A1C is, which is your average blood sugar over the last 3 months. but it's also really important to know what your fasting insulin is. This will tell us how hard your body is working to control your blood sugar. Now, why am I talking about blood sugar in a perimenopause presentation? It's because when you have improved blood sugar, this may actually improve hot flashes as well. It's this big up and down variation in your blood sugar that can make hot flashes worse, more frequent, and more severe. We also know that when you have better blood sugar control, you're going to have less inflammation. And less inflammation, in turn, will be supportive to your hormones. Your hormone receptors are going to function better. The ability to metabolize sugar in perimenopause changes. When you have declines in your hormones, you are going to be less efficient at managing your blood sugar. And this is where we can see weight gain, resistant weight loss, especially the weight around the midsection. Having insulin resistance is problematic as well for your muscle mass. More insulin resistance, more inflammation can lead to muscle mass loss and an overall reduction in your basal metabolic rate. I want to go through my favorite slides. If you're a patient of mine, for sure you've seen this. If you've joined any of my past webinars, you've seen this as well. Insulin resistance, I truly believe, is at the root of so many health conditions, whether it's weight related, it can make your hormones levels worse, it can contribute to hair loss, it can contribute to acne, it can contribute to mental health changes. So this is something that I'm really, really passionate about. So when you consume carbohydrates, whether they're healthy carbohydrates like fruits and vegetables or unhealthy carbohydrates like cake and cookies, those carbohydrates are going to be digested and broken down into glucose or sugar. And that's going to cause your glucose or sugar to rise in your bloodstream. That's all normal. Now, after you have a rise in your blood sugar, that's going to send a signal to your pancreas to start making insulin. And if you're on the webinar, you'll be able to see insulin is shown here as the key. So the red squares are the sugar, the key is insulin. And the role of insulin is to help open up the door on the outside of the cell so the sugar can get in. This is really important. We want the sugar to go from the bloodstream into your cells so that you're satiated, so that you have good mental clarity, so that you have good energy, so that your muscles can work, and so that your blood sugar comes down and you will maintain your weight easily as long as you have a great efficiency with this lock and key. In insulin resistance, which gets worse in perimenopause and menopause, we lose this efficiency. The lock and key becomes jammed. So now what can happen is as your blood sugar rises, your body makes the key. Of course, it still makes the insulin, but it can't open the cells. So the sugar is still high. The body's going to make more keys or more insulin. And this cycle is going to repeat and repeat. And what will happen is over time, the insulin levels will rise and rise and rise and rise. And when insulin levels rise, it will say to the body, okay, the sugar's still here in the bloodstream. We can't leave it here because that will damage the eyes, the kidneys, the nerves. What's plan B? And under the presence of high insulin, the plan B is to take the sugar out of the bloodstream and put it away in storage. We can store sugar as body fat. We can store it as triglycerides in the liver. And this is why with insulin resistance, we see weight gain around the midsection. And we can also see the liver becoming congested, meaning the triglycerides go up. Maybe we see non-alcoholic fatty liver disease. We can also see the liver enzymes rise at that point in time. This blood work is really important because I think it clearly demonstrates why comprehensive blood work is so important. So this was one of my patients. Their average blood sugar, or their A1C, was sitting at 5.6. So their doctor said, everything's fine, everything's normal, there's no concerns here. Now, I always will run an A1C. I still want to know what your average blood sugar is, but I take it one step further and I run a fasting insulin. That's the key that we saw in the last picture. And the insulin will tell us how hard is the body working to control your blood sugar. As you can see here, despite this individual not being pre-diabetic, told everything's fine, they have really high levels of insulin. And that's why they're seeing concerns with the weight gain, especially weight gain around the midsection. And I observe in many, many of my perimenopause patients that as estrogen levels decline, this insulin level will go up. So this is something to consider. Signs of insulin resistance: increased thirst, fatigue, increased urination, weight gain around the midsection, fatigue, especially after high carb meals, feeling anxious, shaky, sweaty, moody, lack of focus. In perimenopause or women that are cycling, insulin resistance can lead to acne, missed periods, hair loss, weight gain. And in postmenopausal women or women who are at the tail end of their perimenopause, the ups and downs in your blood sugar can increase hot flashes, can cause increased cardiovascular issues, and increased belly fat. Here are the lab markers that are included in the panel that I run for women in perimenopause and menopause. You can see here, you need your average blood sugar, but you also need that fasting insulin, the lipid panels there, the markers of inflammation there, and liver and kidney function. One of the supplements I wanted to talk on for individuals who have insulin resistance is berberine. Berberine has been shown to be as effective as metformin for lowering hemoglobin A1C. It can also make improvements in your fasting insulin, your triglyceride levels, and your LDL levels. The dose that we typically see in research is anywhere from 1 to 2 grams a day, and this is divided with meals. So if you're taking berberine to prevent your blood sugar from spiking, you want to take it with the meal. Now, in rat studies, they took the rats, they fed them a diet that was high in sugar. The diet was inducing liver disease. And what they found was the rats that took the berberine, they had decreased total body weight, decreased weight gain around the midsection, better levels of cholesterol, and reductions in liver enzyme and improvements in liver function. How does berberine work? So berberine has a couple different mechanisms of action. So as you saw on the previous slide, my favorite slides with the lock and key, berberine essentially can help make the lock and key more sensitive or make it work more efficiently. It unclogs that lock and key. And interestingly enough, berberine also impacts the gut microbiome. Now, this is particularly fascinating to me because the new research that we're seeing is that the gut bacteria that you have can actually influence your weight. And if you have the wrong types of gut bacteria, you're more likely to have issues with your blood sugar, more likely to have inflammation, more likely to have insulin resistance and weight gain. So one of the mechanisms of actions in how we feel berberine works, not only does it improve the receptor function, but it also shifts the gut microbiome in a favorable way to improve gut health that helps to support blood sugar management as well. Shifting gears into the liver and kidney. The liver is really important when it comes to perimenopause because this is the organ of the body that helps to clear out toxins, helps to transport your cholesterol, helps to transport your hormones. The liver actually metabolizes hormones. And this is what we can measure on the Dutch test, the urine test we talked about. We can see on the Dutch test how your liver is breaking down estrogen, and the different breakdown products of estrogen can be beneficial or they can be more harmful. And that's one of the really great aspects of the Dutch test. It can look at those metabolites. Blood sugar ranges. The optimal levels for insulin and hemoglobin A1C do depend on the individual and depends on the symptoms. So again, at the end of the presentation, I'm going to be sending over a lab test cheat sheet where you can see what I would consider optimal ranges, what you can ask your doctor to test for, you can order on your own, and what are some tips in order to address it. I want every one of my patients to be within the optimal level. I like to see a fasting insulin less than 2 for optimal. 2 to 6 is completely fine. And it depends on if you are looking at the reference ranges that are typically reported in Canada or the US, because they're different for insulin. So if you're in Canada, I like to see a fasting insulin anywhere from 20 to 40, in the US 2 to 6. Now, this is for optimal. If you are maintaining your weight just fine, you don't have any hormone symptoms, your cholesterol is fine, and you're feeling really good, and your insulin is sitting at an 8, that is completely fine. One of the concerns that I had when making this optimal guide is it's very individualized with everything. Really important that you look at what the optimal ranges are for you, each individual. In terms of an optimal hemoglobin A1C, we want to see that less than 5.4 for optimal. If you're sitting at 5.5 and you're there for the rest of your life and you're feeling good and everything's great, I'm happy with that. So it is individuals. I like to see fasting glucose anywhere from 70 to 85 for optimal. And I get the question often at this point in time, what are my thoughts on a continuous blood sugar monitor? I think a continuous blood sugar monitor is a great option for individuals to learn how their body responds to foods. But remember, it's only testing your glucose. It's not testing your insulin or how hard your body's working to control your blood sugar. So in the early stages, it may not show anything for you. During perimenopause, it's also really important to test your thyroid and a full thyroid panel, as well as your cortisol levels. And that is because the symptoms related to perimenopause are very similar to the symptoms that we could see in thyroid disorders. The symptoms of perimenopause are also similar to the same symptoms that we can see in high stress individuals or poor sleep. So this is something where, again, we can't just test the hormones. We need comprehensive testing to really understand the full picture. Symptoms of low thyroid could also be weight gain, fatigue, brain fog, depression, anxiety, hair loss, brittle hair, feeling cold, infertility, and miscarriages. So a full thyroid panel is needed. Symptoms of high thyroid, fatigue, heart palpitations, anxiety, weight gain, insomnia, sweaty hands. So as you can see, these symptoms do overlap. When it comes to thyroid testing, TSH is not enough. TSH only tells us how the brain is communicating with the thyroid gland. It does not tell us, is the thyroid actually producing adequate levels of thyroid hormone? You really need to know what your levels of free T3 are. This is the active form of thyroid hormone. Free T4 is also important because this is the storage form of thyroid hormone. And you also want to test your thyroid antibodies. Why do you test thyroid antibodies? Because thyroid antibodies can be elevated anywhere from 5 to 10 years prior to the thyroid becoming an issue. Now, you may not need any treatment if your thyroid antibodies are elevated, but it can give us an insight and a look ahead and prompt us to say every single year we need to repeat a thyroid panel, a full one, to make sure that things are not getting worse. There's also some things that you can do to lower thyroid antibodies, but there's not a lot of evidence that shows that a lower thyroid antibody level creates favorable changes in symptoms. In some of my patients, it does, and some of my patients, it does not. I really like this diagram for those of you who are joining on the webinar, because it really does illustrate what goes on after the thyroid produces T4. So the first hormone that the thyroid produces after the brain tells the thyroid what to do, it produces T4. This is storage. This doesn't bind to the cells. This doesn't have a lot of metabolic activity. That T4 has to be converted to T3. And it's the T3 that binds onto the cells and turns it on. Things like selenium and zinc are really important to help T4 be converted to T3. Selenium you can get from Brazil nuts, 2 to 4 a day. Zinc, a great source of zinc is oysters if you like that, or pumpkin seeds. About 2 tablespoons of pumpkin seeds a day can help you with your zinc levels. Another interesting thing to note is that T4 can also go down another pathway, and that's the reverse T3 pathway. Reverse T3 looks similar to T3. It can bind to the cell, but it does not turn it on. And a key thing to recognize is elevations in T3 will compete with the T3, the active thyroid hormone, to turn the cell on. Stress, too low of calorie diets, inflammation can all raise reverse T3. And this can happen in perimenopause because it definitely is a stressful time. You're having changes to your identity, changes to your career, perhaps changes to your household in terms of perhaps your children are leaving during that point in time. Perhaps you have the stress of also being sandwiched, taking care of elderly, aging parents. It is a challenging time. We know the hormones decline. We know that that can influence your ability to handle those stressors. So this is where looking at the thyroid during this time is particularly important as well. When it comes to stress, so we talked about previously how stress can impact the thyroid gland by increasing reverse T3. Stress or cortisol, our stress hormone, follows this pattern. It should be high in the morning and low before bed. This is where the Dutch test can really help because it's a 4-time test that you do with urine samples throughout the day. So we can more accurately depict what this cortisol response is doing. Really low cortisol in the morning can cause fatigue. So if you're waking up unrefreshed, it could be that your cortisol is actually too low in the morning, because cortisol is the hormone that like gives us energy to get up, right? Get up, get going. So if it's really low in the morning, that could be related to chronic stressors. It could also be related to sleep apnea. And the other thing I wanted to point out here is every time you spike your blood sugar with a meal, you can see a bump in cortisol. This is fine as long as you're not snacking all throughout the day. So when individuals have issues with their nutrition, issues with their blood sugar, issues with insulin resistance, issues with food cravings, and they're snacking all throughout a day, that's actually a stress on the body because you're not giving your body enough time to get into the rest and digest stage, and it's something to consider. Cortisol is also really important when it comes to perimenopause and menopause, because remember, you're at increased risk of having these hormone fluctuations. You're seeing a decline in your hormones. And the interesting thing about cortisol is cortisol can actually take your progesterone and lower it. So this is what we call the cortisol steal. You can see it here on the slides if you're watching over on Zoom. And when the progesterone level is already susceptible to being too low in perimenopause, you throw on stress there and it can lower it even more. Progesterone is really important because it goes to the brain and it stimulates the GABA receptors. So it's actually helpful when it comes to anxiety. So if you don't have enough progesterone, you could feel more anxious. In addition, progesterone is really beneficial for sleep. So when we're seeing some of those sleep disruptions, it's often due to a deficiency in progesterone. This is the Dutch test. We talked about some of the benefits of the Dutch test. This is where you perform the urine test 4 to 5 times throughout the day. We get that cortisol curve, and it looks at how hormones are being broken down. Here is the first page of one of the Dutch tests that shows that cortisol response. It can also show us your total levels of estrogen, progesterone, testosterone, DHEA. And on this page, it's really nice because it shows us how all of the hormones are interconnected. And for anybody who's considering hormone replacement therapy, one of the nice parts that the Dutch test does show is if you're taking extra hormones, how are they most likely to be metabolized, because this is genetically based. We actually want all of your estrogen, the estradiol, the estrone, to go down the green pathway that you can see here. This is protective. Remember, we talked about all of the benefits of estrogen in terms of protection from bones and cardiovascular disease. But there's certain breakdown products of estrogen that are less favorable. For instance, if you go down this red pathway, that can form what we call quinone adducts, which damage DNA. And this can increase your risk of estrogen-dependent cancers. So when we're looking at HRT and hormones in general and overall risk associated with them, this could be something to consider to look at based off of your genetics. How are you metabolizing those hormones? I also really like the Dutch test prior to anybody taking testosterone replacement therapy. And here's why. The Dutch test can look at what is the likelihood that your testosterone is going to be converted to super testosterone, which is dihydrotestosterone. Because the Dutch test looks at an enzyme activity called 5-alpha reductase. If you have 5-alpha reductase activity that is high, you may actually convert your testosterone to dihydrotestosterone at a faster rate, and you could experience side effects from testosterone replacement therapy, such as hair loss, acne, more oily skin, and hair growth on the face. That's an option for individuals who, if they're a little bit hesitant with testosterone replacement therapy and they don't want to experiment with low dosages, if you're able to run the Dutch test, that would better predict your response and what it would be. 5-alpha reductase activity, when it's particularly high, I see lots of hair loss patients come back to me after having pellet therapy. They didn't have blood tests prior, they didn't have the Dutch test prior, and unfortunately, after the pellet therapy, they saw a lot of hair loss as a result. So this can save individuals those side effects. I want to touch on the Women's Health Initiative study, what this was, what it actually looked at, because the Women's Health Initiative study in the late 90s, really created a big scare and concern around hormone replacement therapy. And I think it's done a really great disservice to women's health in general. The results of this study were misinterpreted. The study was flawed, and it created this widespread panic where everybody said, oh my gosh, hormone replacement therapy is increasing risk of stroke, cancer, nobody should take it. Now, the flaws of this study, most women in the study were more than 10 years older than the onset of menopause. They were well over 60, and that's not even who we're prescribing hormone replacement therapy to. Many of the individuals, the females included in the study, not only were they greater than 63 years old, but they had other health conditions. They had obesity, they had smoking, they were smokers, they had cardiovascular disease. And the women in the study, they did not have any symptoms related to menopause. And the reason they had to choose women that were not symptomatic is because if they did have symptoms and they were in the group that received the HRT, their symptoms would go away, and then they would know that they received the therapy versus the placebo. The HRT in this study, I think this is the most important part. The HRT that was used in the Women's Health Initiative study was conjugated equine estrogen plus synthetic progestins. This is not what we're using for hormone replacement therapy today. And bioidentical hormone therapy is very much different than these synthetic hormones that were used in the WHI study. The media also reported relative risk, not absolute risk. So from this study, what was concluded is estrogen plus progesterone therapy increased the risk of stroke, deep vein thrombosis, pulmonary embolism, MI in postmenopausal women. Now, again, these risks were associated with synthetic hormones, not micronized progesterone, not bioidentical hormone replacement study. The actual reality is that these risks apply to synthetic progesterone and oral estrogens. That is not what we're using today. In terms of bioidentical hormone replacement therapy, patches, topicals, this is very, very different than oral estrogen. Oral micronized progesterone actually reduces the risk of breast cancer, and I've linked the 2 studies that have evaluated that more recently. The other thing to keep in mind is the risk of breast cancer is lower in women taking any form of HRT compared to women who do not exercise. Which, let me repeat that again. The risk of breast cancer is lower in women who are exercising and taking HRT than women who are not exercising. So it's really important to consider exercise, of course, at any point in time, whether you are cycling, perimenopause, menopause, resistance training and exercise is really important for the reduction in breast cancer, and HRT did not increase that risk. What are the benefits of bioidentical hormone replacement therapy? Of course, symptomatic relief, all of those symptoms that we talked about at the start of the presentation. Estrogen therapy can alleviate those symptoms, hot flashes, mood swings, sleep disturbances, and this can significantly improve quality of life in women in perimenopause and menopause. We saw that estrogen has beneficial impacts on the heart, so the cardiovascular system, and bone health. And there are some studies that suggest that estrogen therapy may have a positive impact on cognitive function. So mental clarity and reducing the risk of Alzheimer's and dementia. Further research is needed. And unfortunately, I don't know what it is about women's health, and it's very upsetting and very frustrating that there just is not as much research and as much funding into women's health, but we're actively trying to change that. What do you do if you want to order these labs? So there's a couple options. If you are in the US, there is so many options for you to order your own blood work. One example of this would be Rupa Health. This is a wholesale lab company. I think they actually have really great customer services and really great pricing. And what happens with Rupa Health is you purchase the blood work, you get a requisition that's digital, and you just take that into the lab. Now, this is not my requisition. This is nothing to do with me, but this is a resource for you to consider through Rupa Health. Now, in terms of ordering the labs that we talked about in this presentation, I've put together 2 bundles. So there's the Women Comprehensive Yearly Bundle. Everything that we talked about is in that, and you can order that through Rupa Health. The Women's Hair Loss Bundle is the exact same as the Women's Comprehensive Bundle, but it has 2 extra markers. So if you're in perimenopause, you have hormone-related symptoms, and one of your symptoms is hair loss, order the hair loss bundle. If you have hormone-related symptoms, you want to test your hormones, you want to test your thyroid, your insulin resistance, your inflammation, but you don't have hair loss, order the comprehensive. And if you have any questions about that, just let me know. So what happens is Rupa Health is connected with LabCorp. So what you do is you purchase the bundle, you get your digital requisition, and you just take it into a local LabCorp. They will do the blood draw. The blood draw fee for LabCorp is already included with Rupa Health, so you don't have an additional fee to pay there. The comprehensive bundle tests FSH. Remember, that was the one that can predict how close you are to menopause. It's not, 100% that we can say with certainty that you'll never get a menstrual cycle again if your FSH is elevated, but it can provide us some insight. The comprehensive bundle tests your hormones, the full thyroid panel that we talked about, inflammation, your cortisol levels, nutrient levels, cholesterol, liver, and kidney function. And the link for this, if you're on TikTok, it is in my profile. It says order your own blood work. Through Rupa Health, you can also order the Dutch test. If you are just ordering one, I would highly encourage you to do the blood work. I think it's more comprehensive. I think it provides us with a lot more insight to your thyroid, your blood sugar, your inflammatory levels. The Dutch test is a deeper dive in how your hormones are interacting together, how your hormones are being metabolized from the liver. And of course, the Dutch test can look more deeply at cortisol, the stress hormone. If everything was free, I would say go for it and test both. I think both are wonderful. The Dutch test is not something that you repeat over and over and over again. In my practice, if someone's running the Dutch test or we're worried about perhaps some negative side effects with testosterone replacement therapy, or we're wanting to see the cortisol response, or we're wanting to see how the hormones are metabolized, we look at that Dutch test and then we just continue with blood tests moving forward. The Dutch test is, I think it's a wonderful test, but of course, having both the blood test and the Dutch test will add up. So if you can just do one, I would go for the blood work. All right, this is just showing you the perimenopause, menopause lab testing sheet. I will send this over to anybody who is registered for the webinar after. If you're not registered, just send me a message. I'm happy to send this over to you. You're going to get this tomorrow, and this is all of the markers and what the optimal ranges are. Keep in mind that hormones in perimenopause do fluctuate. Hormones for women will fluctuate every single month depending on the day. So we do have to interpret those levels depending on where you went in your menstrual cycle. You could also take this cheat sheet and have your family practitioner, your primary care, run these labs for you. They absolutely can. And this is everything that I would want to see for anybody in menopause, perimenopause who are struggling with their hormones, as well as testing those other things that can mimic the same symptoms. So I hope that was helpful for you. I'm going to dive into some of the questions that are here on the chat, some of the questions that I received ahead of time from individuals that emailed me. And if you have any additional questions, I will look on the TikTok account as well. Now, if you're on TikTok and you're asking to send the cheat sheet, I definitely can, but I'm not going to remember your username after. So please just send me over a message. There was a question that was about protein on a vegetarian versus vegan nutrition plan. I'm trying to pull up that exact question because now I've forgotten what it is. I would say whether or not you're consuming animal-based protein or you're considering plant-based protein, as long as you're getting your minimum requirements in. One of the concerns with vegetarian-based protein sources, or it's not really a concern, or just something to keep in mind, is that plant-based sources of protein are usually higher in carbohydrates. So you might have to be more mindful if you have insulin resistance of that and be smart with your choices. In terms of specific advice to someone who adheres, you might have to supplement, right? So if you're on a vegetarian or vegan-based diet and you're having a hard time meeting your protein requirements, I would recommend get a protein powder that you like, maybe a hemp-based protein powder, a rice-based protein, pea-based protein powder, one that you like and enjoy. That would be a great way to supplement. I don't always hit my protein goals with whole foods. I think that's the goal. I would rather hit my protein requirements with whole foods, but I don't always, so I supplement with a protein shake. How do you know if you're in perimenopause and having estrogen dominance? So this is a really great question. So again, remember, it's perimenopause and menopause is not this nice gradual decline in your hormones. What we can see is, yeah, the estrogen begins to decline, but sometimes your progesterone's low, sometimes it's high, sometimes it's low. So I actually see women in perimenopause having this higher levels of estrogen related to the progesterone initially. And that higher levels of estrogen can contribute to weight gain, especially in the lower half, the glutes, heavier breasts, mood swings, migraines, headaches, painful ovulation. Okay, yeah, everything that you listed there. So if you do have estrogen dominance, and that's been confirmed with blood work, you could consider running the Dutch test to see how your hormones are being metabolized, how the estrogen is being detoxed from the liver. When it comes to estrogen, think cruciferous vegetables. Cruciferous vegetables, broccoli, kale, cauliflower, bok choy, Brussels sprouts, all of that contains sulforaphane, which can be really beneficial to clear out estrogen. You also want to support liver health. That's where your hormones are going to be metabolized. Now, your liver does its job. It does its job all of the time, but sometimes we overwhelm the liver by drinking alcohol, having too many medications that might not be necessary, having toxins in our life. The liver needs to process that. So if you can reduce alcohol, that's great. Reduce processed sugars, cruciferous vegetables, and there's supplements available out there. So things like N-acetylcysteine, B vitamins, magnesium, milk thistle can be helpful. So all of that could be something to consider. If you take HRT, should you only do bioidentical, not synthetic? Bioidentical hormone replacement therapy. So it still is a prescription. And oral progesterone, in my opinion, has more benefits than topical progesterone because oral progesterone is metabolized by the liver. And it's actually the metabolized or the breakdown products of that oral estrogen that have some favorable benefits in terms of reducing anxiety and helping with sleep. What you're looking for to know that you're on bioidentical hormone replacement therapy, the prescription is either prometrium or it's compounded as progesterone. You do not want synthetic progestins. The synthetic progestins and the oral estrogen is what was associated with the increased risk of cancer and stroke. You always want to review with your doctor. Whenever one of my patients comes to me and says that they're on HRT, I always want to see exactly what they're on because sometimes, unfortunately, people think they're taking hormone replacement therapy, but it's birth control or synthetic progestins that they were actually given. Is it true if you have high ferritin that this could be a sign of inflammation? Yes. So one of the things that I do on blood work testing, so remember perimenopause, you can have heavier, more frequent cycles. And I always screen all my perimenopause patients for iron deficiency anemia. And that includes a ferritin level, which is the storage form of iron. Now, on that blood work, not only do I run ferritin, but I also run markers of inflammation because if you have high levels of inflammation, that can artificially raise your ferritin levels. So we might look at your ferritin and be like, wow, your ferritin looks great, you're fine. But if you have higher levels of inflammation, it could be artificially making it look normal or even making it look high. If you have high ferritin, you may want to consider, well, I gotta verify this over on TikTok. If you have high levels of ferritin, you may want to consider testing your inflammatory markers, your hsCRP. And if your inflammatory markers are high, you need to look at why it's high. Because just because a CRP is high or your ferritin high, that doesn't give us any idea where the inflammation is coming from. And yes, high ferritin can also be due to hemochromatosis. So if your inflammatory markers aren't high, if we're seeing other changes in the size of the red blood cells, hemochromatosis would be something else to consider. The chat was disabled. Oh, thank you for letting me know. I'm seeing these questions through the Q&A. So if anybody has, thank you for letting me know. If anybody has questions and they weren't able to submit them through the chat, submit them through the Q&A. Weight gain, hard to lose, new cellulite, stretch marks. Yeah, that can absolutely be a sign of lower amounts of hormones or even higher amounts of cortisol. Is FSH and LH best tested with blood on day 2 to 3 of the cycle? So it depends on what you're looking for. So technically, yes, FSH and LH would be best tested on day 2 or 3. I include them with the blood panel and tell all my patients to go 7 to 10 days before their menstrual cycle. Because if your FSH is elevated 7 to 10 days before your next menstrual cycle and your estrogen's low, that both points to perimenopause. I think time is very valuable and I appreciate a lot of my patients are very busy, whether they are looking after their children or their parents or they have careers. My patients are usually really busy. And for me to send them for blood work multiple times throughout the month, if it's not going to really benefit them, I don't like to do. So I always send individuals, try to do your blood work about a week before your next menstrual cycle. If your cycle is irregular, you don't know where to go, you can reach out, or when to go, you can reach out to me. Should you take berberine before a high carb meal or with every meal if you're pre-diabetic? So the studies on berberine were taken with a meal or before a meal. And berberine, when taken before a meal or with a meal, if you forget, can reduce how high your blood sugar spikes and how much your insulin spikes at that point in time. Berberine does have a relatively short half-life. Its half-life is about 4 to 6 hours. So that's why it has to be taken throughout the day with each meal. What is the best time to do the blood work? Great question. Yeah, so ideally you want to do the blood work about a week before your next expected cycle. If you have an irregular cycle, if you don't know where to go, this is where it's often better to have an initial consult first, discuss your symptoms, what testing we want to run, then we explain this and go run it. But if you're just wanting to do your blood work 7 to 10 days before your next expected cycle. Does having an IUD matter? Yeah. So if you're on a copper IUD, you can go ahead and test your hormones because that copper IUD is not going to influence your hormones. If you have a Kyleena or Mirena IUD or any sort of hormones that you're taking in the form of birth control, whether it's the pill or an IUD, that is going to change your levels of hormones. Usually, I do not bother running an estrogen or progesterone on a woman who has a hormone-based IUD because the blood work's just going to come back and say, hey, you're on a Mirena IUD, and we already know that. You can still run an FSH. So sometimes patients of mine are in perimenopause and they want to know, I haven't had a menstrual cycle. Am I in menopause? Can I take my IUD out? Can I not take my IUD out? In those cases, we can have a look at FSH. And if you're on a hormone-based IUD, we can still run the androgens. So things like testosterone, DHEA, things like that. But if you're on a hormone-based IUD and you want to run the blood work, just send me a message. I can remove the estrogen, progesterone. You don't need those ones. When and what testing should be tested to determine the cause of hormonal migraines? The comprehensive blood work panel would be great. It has a look at your hormone levels. We can see if you're having a rise in progesterone, if you're ovulating. Other things that can cause migraines would be changes with your cortisol, your stress hormone, your blood sugar, your thyroid, nutrient deficiencies, iron deficiency can cause headaches and migraines as well. So that's all tested for on that bundle. What if you live in Canada for testing? So in Canada, you cannot access blood testing without a requisition from a physician. Now, if you're in Ontario, I can help you with that. If you are outside of Ontario, send me a message. I perhaps have a colleague that I can refer to. So I can only work with individuals from Ontario in terms of getting you access to the blood testing. I have had Canadians. It's really interesting. Private blood, this is a big eye opener for me. To get your blood work done in Canada privately is actually more expensive than getting your blood work done privately in the US. So I have had Canadians go over the border and have their blood testing done through Rupa Health at a LabCorp. How many vials of blend do they take with the hair loss bundle? I've had this question a time again, and I've meant to reach out to Rupa Health and I forgot. So if you send me a message with that same question, I can reach out to Rupa Health and ask. I don't want to guess incorrectly, but I would say at least 5 vials because when we test for different things, they need different tubes with different ingredients in it. So at least 5 that I can think of off the top of my head. Is there any time I would recommend doing the Dutch test more than once? You can, yeah, you can do the Dutch test more than once to see if your treatment plan is working, to see how your hormone levels are changing. I have some patients with a strong family history of estrogen-dependent cancers that we run it on yearly. But for individuals who have went through menopause, we already have them on their HRT routine. We already know that their blood levels are great, their symptoms are well managed. You don't, in my opinion, you don't need to keep testing that. If your cycle is irregular, what day for the Dutch test? I would send me a message and I can help you navigate that. The prices for Rupa Health are in USD. And if you're wanting blood work testing done in Canada, send me a message. I can see if I can help. If you're Ontario, yes, I can help. If you're outside of Ontario, I might have a colleague that I can refer you to. The best time of the month to get the testing done, I would do it all about a week before your menstrual cycle. So if you have a 28-day cycle, a week before. If you have a 26-day cycle, a week before. And remember, with hormones, they fluctuate, and it's not always straightforward to get hormone testing done. That's why a lot of doctors will discount the value of hormone testing, because they'll say, it's too hard to predict. We don't know what's going on. But I think if we take the time and we understand when you went for the blood work in relation to your cycle, it can be quite insightful. I had a patient with hair loss. Her androgen levels were not high, but every time we ran her blood work, it was about a week before her cycle, but her progesterone was always low. And I was like, why is your progesterone always low? So it led us to investigate whether or not she was ovulating. We did basal body temperature tracking. I taught her what that was and how to do it. And we also did urinary LH strips. And we repeated her blood work as well. And in doing so, we actually discovered that she wasn't ovulating. So her hair loss wasn't actually due to the androgens. Her androgens were here, but she wasn't getting her androgens balanced with the progesterone because she wasn't ovulating. And that was actually the root cause. Now, that's not common that we see a regular cycle with anovulation, but now she knows, and it led into some deeper investigation for her, which is great. Will the blood work show high, low cortisol, androgens, estrogens? So the blood work will show your cortisol, it'll show your hormones, it'll show inflammation. The blood work is the most comprehensive. The Dutch test shows us how your hormones are being metabolized through the liver. And the Dutch test also gives us a deeper look at cortisol levels and how they fluctuate throughout the day. What are your thoughts on cyclical BHRT during perimenopause and postmenopause? So it depends on the individual's response, their lifestyle, what they're willing to do. Some individuals are sensitive to progesterone. For many individuals, it helps with sleep, it helps with mood, but for other individuals, they may experience water retention with the progesterone. But we know that oral progesterone is really important when you're on transdermal estrogen to protect the uterine lining. So if you have a uterus, it's really important that you're on the oral progesterone. Now, the minimum number of days that you have to take the oral estrogen for the uterine lining protection is 12 days. So that's something that you want to discuss with your practitioner. What if you have very low ferritin and normal hemoglobin? So hemoglobin will tell us if you're anemic. Ferritin tells us how much stored iron you have. So how much do you have left in savings before you go anemic? Now, I see many, many individuals with hair loss where their hemoglobin is low or normal or on the low end, but their ferritin is really low. You need your ferritin, in my experience, 80 to 100 for good hair growth. So it doesn't matter to me that your hemoglobin's fine, that you're not anemic. I think that's wonderful. But if you have low ferritin, getting that up can really help with energy and mental clarity, ADHD-based symptoms, bruising. Iron's really important for your thyroid. It's important for your blood sugar management. So that's needed. Lactoferrin definitely can be helpful for raising ferritin, in addition to a diet rich in iron supplementation. And everybody is a little bit different. So when I see patients who have low levels of ferritin, we talk about an individual's treatment plan for them. Facial hair, acne on the jawline, oily skin, that could be a symptom of high androgens, whether it's testosterone, DHT, androstenedione, DHEA. The blood testing there could provide more insight. An HbA1c of 5.6 and a fasting insulin of 8.2, is this considered insulin resistance or its normal range? So one thing to consider is insulin resistance is a spectrum. And you could have mild insulin resistance, significant insulin resistance. It depends on a number of factors. I don't want to get on to specific individualized markers on this webinar because I can't provide you with accurate information or education without knowing your health history and seeing those labs. One thing that you could do is you could go to thebloodcode.com and you could look at your triglyceride to HDL ratio. Your triglycerides and HDL should be about 1-to-1. And if this is all overwhelming to you, I completely get it. And this is why I spend an hour to an hour and a half with patients on a one-on-one visit. going through slides and pictures and helping them understand. And I put everything in a summary because I know it can be overwhelming. I would look at your triglyceride HDL ratio. That can suggest insulin resistance. I think an A1C, anything over 5.4 suggests insulin resistance. A BMI of greater than 27 is strongly correlated with insulin resistance as well. An optimal time for the Dutch test is about a week before your menstrual cycle if you're cycling. Is there a way to get blood work done besides your family doctor in Canada? Naturopathic doctors in Canada can run blood work privately. And I've also heard many Canadians will go over the border and access blood work privately through Rupa Health. Any recommendations with sleep issues? So with sleep issues, I would suggest figuring out why that is. Is it related to cortisol, your stress hormone? I personally see a psychotherapist on a regular basis. That really has been so beneficial for me. I highly, highly recommend it. I see Pam Sethi at Delphia Wellness. I think she's absolutely amazing. She deals with women, career-driven entrepreneurs, busy moms, burnout. She's helped me a lot. So if you need a recommendation for Pam, just send me a message. I can send you her contact. She has been astronomically helpful for my cortisol levels and sleep. If you're always waking up between 3 and 4 a.m., it could be blood sugar, it could be cortisol, it could be your hormones. It's always best to test. If you're taking a GLP-1 to help manage inflammation and insulin during perimenopause, I understand also adding berberine can drive blood sugar low. It could. And that's where speaking to your practitioner on whether or not it would be beneficial to add on berberine could be helpful for you. So hypothetically, if I'm just speaking in general, if I have an individual who's on a GLP-1 medication and we don't want to increase the dose, or they don't want to increase the dose because it causes side effects for them, but their blood sugar is still not accurately managed, that might be an indication to start the berberine or inositol. For individuals who do not have significant insulin resistance, the risk of hypoglycemia I find is less. For individuals who don't, obviously type 1 diabetes, you really, really want to be careful. But it really depends. So if you want to set up a one-on-one where we can discuss your case individually, we definitely can. Amazing presentation. Looking forward to the cheat sheet. And if you're in Ontario, great. Yeah, we can definitely set up a one-on-one if you're in Ontario and get your blood work run. If you get water retention with progesterone, can you use it vaginally? It depends. There is vaginal progesterone available, but that's something that you want to talk to your doctor about or your pharmacist to see. And oral progesterone is the one that provides the most benefit in terms of the uterine protection. You can get away with a Mirena IUD as well. That does protect the uterine lining, but the problem with that is it's going to be the synthetic progestins, not the oral progesterone, and then you're not going to get the beneficial impacts on the brain. In terms of iron supplementation, I never talk about dosaging of iron, forms of iron, because iron is not something that you want to take unless you need iron. And I much prefer to see your health history. I want to see your labs to provide an accurate reflection for you or an accurate recommendation in terms of the dose. The other thing with iron supplementation is it's really important that you look at why your iron is low. Is it lack of dietary intake? Is it heavy menstrual cycles? Is it a gut issue where you're not absorbing it as well? And you need to look for the root cause, because I see lots of individuals that are on iron forever, and it's not making things better. And I think it would be doing a disservice to you to just say, take this iron. I think it's important that we review your health history, figure out what's going on, supplement if needed, if it's safe and needed for you, and then repeat the testing. Can you take inositol for blood sugar control if you have low testosterone? Yes, inositol is not going to lower your testosterone. Will I receive an email with the blood test results? Yeah, the blood test results, if you order through Rupa Health, they're sent directly to you. The question over, so I just went through all of the questions over on the webinar, and thank you everyone who signed up for the webinar and joined us. I need to go feed my children dinner at this point in time because they are I'm sure, hungry. All of the additional questions that I'm seeing over on TikTok, I will pop on again to do another live presentation. I'm going to try to continue to do those. The deal with itchy ears, yes, itchy ears and perimenopause, it's due to the decline in estrogen. And I think this is actually more common. The number of individuals that I ask, like, are your ears itchy? And they're like, yes. I think we don't appreciate how common that symptom is because it's not talked about enough. Thank you. Thank you. Yeah, if you want an initial consult with me, feel free to contact Alison. She is my patient care coordinator. She runs everything for me. She can help set you up for the one-on-one. And I know this was a lot to go through, and I know talking about blood work can be overwhelming. Love your supplements. Thank you. And this is something that you can go back and listen to the replay. You can have a look at the cheat sheet. But also working one-on-one, that's my favorite part of my job, going through the blood work with individuals, helping to educate them, helping you to understand, because it's your body, it's your blood work results. I really feel that once you understand what's going on and why you're taking something and how it's impacting you, it really does help you feel empowered to take control of your health. PMDD, yeah, sorry, PMDD, that's what I wanted to mention. If you're experiencing that, look up histamine. Dr. Laura Brighton has a really great article on histamine and PMDD, and that's something that I often see in patients too. So I hope that was helpful. Thank you everyone for joining, and we'll do this again, and you can join me over on TikTok for more live presentations, but definitely I love interacting with individuals on the webinar. And if you're joining on the webinar tomorrow, you're going to be getting a recording and that cheat sheet. So thanks so much, guys. I hope you have a fantastic evening, and we'll talk soon.